going? How are y'all today?
You talking to us? Oh, I'm great.
Excellent, excellent, excellent. It's almost the top of the hour, guys. Let's go ahead and get started. Hopefully, there will be some people that join the conversation. So, welcome back to Vibe Check. We have been going strong since January. It's been very interesting. We've had the opportunity to make a few stops across the state, including Pine Bluff and a couple of stops here in Little Rock. Today, we're going to have an interesting conversation around the importance of STI testing and just how do you navigate the system? Typically, how do you navigate the state system, the resources that should be readily available to us? Go ahead and turn this meeting over today to Brandy, our in-house sex educator, the person that I met because her intro statement was, I am Brandy and I love sex. But yeah, she's good at what she does, so I'm glad to have her as part of the team. Let's go ahead and get this conversation started. Brandy, I'm gonna turn it over to you.
All right. Good afternoon. Good afternoon. Thank you, Dr. Q, for that great introduction. So we are back because it is a vibe check. All right. So as you know, today is National Black HIV Awareness Day. And what a great time for us to talk about sexual health today. So as you know, this day is dedicated to encouraging Black communities, actually everyone, to get educated, get tested, get involved, and get treated. So despite progress, as we know that Black individuals continue to be disproportionately affected by HIV, STIs, and all of those things. And so we want to learn how to protect ourselves and normalize testing as a part of our routine care as we talk about STI and HIV prevention. So today we have Maya Jones, our ambassador, that's going to talk about her experience with getting tested here in Arkansas, because we're going to make this a little bit personal. So she's going to talk about, her experience getting tested and letting you know that, testing is something that we need to normalize, that we need to encourage other individuals to do the same. So she's going to share her journey about what it's like to get tested, because I know some of you may have never gotten tested before, never stepped foot in the health department or never stepped foot in anywhere to get tested. So we definitely want to just go over what that experience was like for her today. You ready, Maya?
I am.
All right, girl. So let's start it off. So what made you decide to get tested? So as an ambassador, what motivated you to get tested yourself?
Yeah, so as an ambassador, I feel like in that role, I can't be encouraging my peers or other young people to get tested if I, for one, haven't been tested myself. I'm not saying I'm out here practicing unsafe sex, but I do believe that if I'm going to be out here, spreading that information, the least I can do is get tested myself so I can be able to share my experience with other people for when they have questions.
All right, awesome. Definitely like that. So, like they say, can't call the kettle black. So definitely want to go out and, get tested for yourself, because definitely, especially as an ambassador, you want to be an example for those. So how are we going to talk about, encouraging people to go get tested if you haven't getting tested yourself? So awesome. So let's just kind of talk about just your experience with getting testing. So how did that feel? Were you nervous? Was you hesitant? How did you feel, just thinking about getting tested and having that, making the appointment and things of that sort?
For me, I wouldn't say I was scared. Me personally, I feel like I can't be in a role like this and be scared. I mean, especially because I'm gonna have other young people who are gonna be scared. And if I'm scared, how am I gonna be able to help them and encourage them to go out? You know what I mean? Like a lot of people don't go get tested or go get the help that they need because of the stigma behind it and just their fear of them, not knowing what to do or what's gonna happen. So it wasn't scary for me. I was actually kind of excited because I never had done it. It was something I was new to, and it was just cool to see, what it was like.
Okay. All right. Awesome. Okay. So let's just kind of start off with how that experience started. So how did you find a place to get tested, and just talk about, how you actually found the place and what was scheduling like for you when you, initially called to get your screening, and how did that go?
So believe it or not, if I'm not mistaken, I think January the 8th is when I started calling around to different health departments. I wouldn't say it was hard, but again, I was calling on January 8th and I didn't get this appointment till January the 28th. And even the other health departments that I called, they had dates that were later than that. So one place that I called was like April 10th, or if I'm not mistaken. But it was easy. I just called, they asked me what's my name, what I was calling for. I told them what I was calling for. I don't recall if they asked me if I had symptoms. But yeah, that was pretty much it. I told them my name and they just scheduled me an appointment and that was pretty much it.
Okay. Okay. So just recap that. So you stated that you started calling on January 8th and then you weren't able to get your appointment until the 28th. So was that a date that you selected or was that just the first available appointment that they had?
That was in fact the only appointment that they had
The
available.
first, okay, first available. Okay, so what was your thoughts, once that appointment date was set? So how did you feel, once, okay, you called, so how did you feel once you had that appointment date set and you're like, okay, I'm really doing this?
Like I said, I was excited. Now, I will say, on the other side, I did feel some type of way because you do have those people who, they don't practice safe sex, or they may be in a situation that may have caused them to, be infected some way, somehow. And so I feel like if they were to call, who knows what their symptoms would be like 3 weeks later, or, what their health would be like. And so I feel like in that case, I mean, it's kind of like a scary and sad situation because not being able to get help to at least 3 weeks later is kind of ridiculous.
Oh yeah, most definitely. Because just think about it. If individuals are calling to get tested, most oftentimes, yeah, you have a couple of people that's going in for just normal checkups, but most oftentimes, I would say, just from my experience, individuals are calling because they may be having some symptoms, or they may see the need to go. So definitely can see how that can be a barrier where you're calling and it's taken almost 3 weeks in order for you to get an appointment. Okay. All right. So, all right. So let's talk about just walking into the health department. So let's go ahead and just go into when you set your appointment and now it is appointment day. So what was the atmosphere like when you arrived?
The atmosphere, I would say, it was like your typical health clinic, I guess. I don't really know what a health clinic looks like, but I kind of just walked into a facility, got on the elevator, and when I walked in, it was very plain, white walls. Um, and when you walk in, you kind of, I think, make a left off the elevator and you kind of go to this little stand where like the employees were working at. And that's kind of it. That was kind of it. It was a very plain setting. Me personally, especially being a youth, and like I said, we're trying to get out of the stigma behind it. I feel like if you want to encourage people to come to a health clinic, I feel like the environment needs to be, have something to it. It shouldn't just be plain walls. I mean, it's already a scary
Right.
situation. You know what I mean? You want people to feel comfortable and feel like that they're, truly getting the help that they need.
Okay, gotcha. So the vibe there was like, I mean, kind of plain, they probably could have jazzed it up a little bit, being that you're trying to get youth and other individuals to come into the health department.
Definitely. And just people in general. I mean, it wasn't, like I said, it wasn't much on the walls. They had like a TV, but me
Okay.
personally, when you go to a place, you kind of want to see stuff beyond the walls, whether it's pictures or, work or, toys. I guess not toys, but, I just,
Gotcha.
you want more stuff in the environment besides the walls and the chairs.
Okay. All right. Perfect. All right. So let's talk about your experience with the staff. So how did the staff treat you? From the person who checked you in, from people, the individuals that may have greeted you when you got there. So can you talk about, how the experience was with, just the staff during the check-in process and how that went for you?
Absolutely. I wouldn't say the staff were rude. They were cool. When I walked in, I had a guy helped me. He was really nice. He asked me when I was first got there, what my name was, what I was here for. I told him my name, told him what I was here for, and then he asked me, do I have insurance, or was I just here for the free clinic? I told him I was here for the free clinic, and then he just gave me some paperwork to fill out. I filled it out, gave it back to him. And that was pretty much it. But besides that, they were real nice. Nobody really had a stinking attitude. If I had any questions, they answered them, without any issues. So it was cool.
Okay. So just to, so you stated that you did not need your insurance, or they didn't require you to show insurance information or ask you to pay for anything when you went there?
No, they did not. But if you do have insurance and if you are, going for insurance reasons, you can, use your insurance. But it was free. I didn't have to pay anything. All I did was fill out some paperwork, say my name, and that was pretty much it.
All right, cool. Well, that's good to know because I mean, we know definitely with youth, you may have some that's on their parents' insurance, but that's good to know that they didn't even ask for insurance information because that's probably something that they do not want their parents to know. So that's great that you were actually able to go there, not have to show insurance information or anything of that sort, and there was no cost to you. So I can say that as a plus, as one of the things, as far as your experience with the health department.
It was also a plus, for those who don't even have insurance. Like, yes, you have those who may be on their parents' insurance, but you also have a lot of people who don't even have insurance. And so, being able to, knowing that they're able to go somewhere and still, get the care or the testing that they need is really great and cool. And I feel like it's a great resource that more people should know about.
Okay. All right. So now we want to get to the juicy part, Maya. So we want you to talk us through what happened. So how was the testing process like? So from the time that you sat down, you met the front office, you checked in, you sat down. So can you walk us through that? So how long did you wait, from when you initially checked in for the nurse to come back? What tests did they do? How did they explain it to you? So walk us through just your whole testing process in general.
Yes, so the actual testing didn't take that long, but I will say the waiting process took a minute. I don't know if this will be the experience for everybody. I think my specific day, they were waiting on a nurse to come from like a different state or something like that. And so I was waiting for probably almost an hour before I got tested. But like I said, it was okay. They were very cool. But once I got back there, I went to a room. You kind of walk in this back area, and in this area, there were like a few pamphlets and signs about like HIV and STIs. But then I would go in this room with the lady. I'm pretty sure, checked my weight and my blood pressure. And then I don't really know the whole process necessarily, but she started the process of taking the blood and the blood testing. And specifically, that test took the HIV and hepatitis C. And that didn't really take long. It maybe took a minute or two. And then after that, I went to another room where we sat at a table. She asked me a few questions about like, how many partners I had, was it the same one like within the last 5 years? Have I been around anybody, that may have been infected, or if I've been around drugs? She asked me, do I think I need PrEP or any of that? And then after she asked me all those questions, she left the room and she allowed me to change. And from there, I got on this like little, if you've been to a gynecologist or just even a hospital, they have like the little cots or seats that you can sit on. I sat on one of those, and then she had me kind of scoot up. I don't know if y'all want all the details, but I scooted up on the seat, so she could be able to, do what she needs to do. And she then used these things, I'll call them duck clips. I don't know if that's what they are, but they like these little vaginal openers or whatever. And she, opened me up, and then she got this swab and she kind of swabbed me. It wasn't really uncomfortable, I would say. I was more so flabbergasted because, what I mean, somebody's in my private area. But, it didn't hurt or anything. And then after that, she left the room, allowed me to put my clothes back on. And that was pretty much it. After that, she told me when I would get my results in about 3 to 5 weeks, or 3 to 5 days maybe. But she also said that I wouldn't get a call if I wasn't positive. And because I haven't gotten a call, I'm assuming I was negative. Well, I know I was negative, but yeah.
Gotcha. Okay, well, thank you for that, Maya, kind of just going through the process. So one question that I have is, so just thinking about the information that the nurse, and I'm assuming that it was a nurse that actually, did your exam and all of that. And I know you mentioned that she gave you information about STI. So how was that? So thinking about a young person that's accessing services in Arkansas, how would you say they did as far as providing that information to you about like HIV, STI testing, what you were actually tested for in PrEP?
I don't want to get nobody in trouble, but I don't really remember them necessarily having a conversation with me about HIV and STIs. It was more so them just asking me questions about if I've been around it or whatever, and if I like need certain things. But besides that, I don't really recall, them just, explaining to me what it is and different ways that I can get it.
Okay, so the educational part, you felt like that could have been a little bit better, as far as like them educating a person on STIs.
Definitely. Especially if you ask me, you know, do I need prep? How do you even know I know what prep is?
Right. Okay.
So
Gotcha.
I feel like, and then a lot of times when people come up in there, they really don't know the extent of the different STIs or the, you know, HIV. So I definitely feel like when people come in, that should be something that they focus on, educating people and, you know, telling them about different ways to deal with it or what to do if a situation happens.
Okay. And as far as did you feel rushed? So was there a lot of people in the clinic? You know, did you feel rushed? Do you feel like there was a reason that that information wasn't provided or them educating you on STIs?
Like I said, I waited a good minute, so no, there wasn't a rush. There were maybe 2 to 3 of us up in there at one time,
Okay.
but, because it was a clinic, I think multiple people was going up in there for different reasons. So
Okay.
it was only like me or 2 other people I think that was there for the same reasons. Me personally, I just wish because there was only when they were, you know, communicating, I guess, about like the nurse or whatever, they were only telling one guy, and I don't know if it was because they didn't know that, you know, the rest of us was here for testing. So, but I do feel like they could have, you know, been more communicating about, you know, what was going on, as well as during time since it was, you know, a downtime and it was way, you know, talk to us about HIV, STIs, you know, what we should expect, or even just have different pamphlets in the main area, not just up in that private area. Because even if people aren't coming for, you know, STI or HIV testing, it's still good for them just to know, just in case, you know, spread the word.
Gotcha. Gotcha, most definitely. So you said it was only about 2 or 3 people in the waiting room, and it took you about an hour to actually go back to the back with the nurse.
Yes, and that was because I think we were waiting for her to get there.
Gotcha, gotcha. Okay, all right, perfect. Okay, so were you anxious and did you feel? I guess when you got done with the test, like were you anxious? Did you feel more at ease after going through that process?
I mean, I wasn't even anxious at the beginning of the process. I mean, again, like I said, it was very cool. And because, you know, I do get tested, I guess, at the gynecologist, and I'm used to
Mhm.
taking blood or, you know, doing their vaginal checks. It wasn't like just, you know, something that I wasn't used to. But yeah, it was cool. I mean, like I said, I take, I guess, this role as an ambassador very serious, and I want to be able to, you know, tell people, you know, what it's like and, you know, different things. I don't want to be somebody who just talks, but, you know, ain't never went through it. I feel like that's very hypocritical of me.
Gotcha, gotcha. Okay, so let's go switch over to your results. So I know you say they mentioned that you will receive your test results in a couple of days, and that if they did not call you, basically you were good. But if they did call you, that means that you were positive. Did they say how you were going to get your test results? So were they going to I mean, even if you're negative, I mean, is there a way for you to go and get your results? Because I know we always talk about knowing your status and people want to actually see the paperwork. So would you be able to go up there and get your test results if they were negative?
I will say when I was first, you know, checking in or whatever, they had this thing for the portal. And
Okay.
I will say when I was first waiting, when I was trying to get on the portal, it wasn't working. And the lady told me that, you know, maybe once I go to the back with the nurse, it'll be set up. But I will say I recently tried to get on the portal and it wasn't really working for me. So for me, I didn't get my results, but I'm pretty sure the portal that they give you, it's supposed to be able to have your results on it.
Okay, gotcha. Because I'm just thinking, even if you're negative, I mean, you still would want, still would want, some type of documentation to show, that you're negative. So, how was it?
Definitely.
Yeah,
Especially if you're in a relationship and, you know, y'all trying to get yourselves checked, you want to be able to have the proof.
Exactly. I mean, and even just seeing the paperwork, I mean, to know that you're actually negative, because I mean, sometimes, I mean, let's just be real, it can slip through slip through the cracks, and you can be positive, and they may just slip through and just not call you, or of that sort. I mean, you never know, but you still want to have a way, which you can actually physically have your test results with you. So, okay, so they did have a portal where you can access your test results, but it just wasn't working at the time. Okay. And then if you were positive, they were going to give you a phone call, where you would come in and potentially get treatment, for, if you became positive.
Yes, ma'am.
Okay. All right. So you say you got tested on January 28th. So hopefully, you should be able to get your test results soon, or at least call somebody to be able to get them. So okay, all right, perfect. So okay, so just thinking back to just your whole experience. So how did that experience change your perspective on just testing in general? So I know you mentioned that you had your pap smears and things of that sort. But how did that change your perspective, actually going into a local health department, which is like a free clinic that individuals can go in to receive testing?
Um, it just makes me think that I feel like a lot of our fears just keep us from doing things. And I just want people to know that there's nothing to be scared about. I feel like it's better to care about your health than it is to, push it away or keep trying to ignore it. Just because, there's other young people out here, trying to crack jokes because you care about yourself. It doesn't mean nothing because at the end of the day, you're the one who's safe, you're the one who's healthy, and they're probably the one in pain, got who knows what going on, and they don't even know what they should be doing. So I just want you to know, like, go get tested. It's okay. There's nothing wrong with it, whether the results are negative or positive. There's a solution for both of those. And you're gonna be okay. It's not the end of the world.
Gotcha. Okay. All right. And what would you say surprised you the most about the whole experience? Just kind of thinking back, from when you set the appointment to actually going, what would you say surprised you the most that you weren't expecting?
The fact that 2 tests, I guess, looked for multiple HIVs or STIs. I forgot to state that the vaginal swab checked for gonorrhea, chlamydia, and trich. So I think it was really cool that just 2 tests could check for 5 different STIs and HIVs was like really cool. Like I didn't have to take 50 million tests because when you go to doctors, they want you to do 50,000 things just to figure out different results. So being able to get in there and get out, it was great.
Okay, gotcha. Okay, so you were able to do a blood test, which and they should have done syphilis testing as well, right? So HIV, syphilis, and hepatitis. Okay, and then they did the vaginal swab. Okay. I would say just thinking about like testing, what are your thoughts on just the time frame, from you setting your appointment to actually getting testing? So what you just thinking about a young adult, what would you think are like some of the things that can happen, with it being delayed as far as you getting tested? What are your thoughts on that? Just thinking about improvements that they can make.
I definitely feel like with them not having, much availability when it comes to like people getting tested, maybe offer resources, maybe like other places they can go to, or just
Okay.
cool tips of how they can prevent or try to be safe during that course. Because again, just because people call to get tested, that doesn't mean that they understand the risks that comes with such HIV and STIs. People don't understand how they're transmitted. And so I just feel like, being able to, when somebody makes an appointment, just telling them some tips like, hey, even though you can't get tested right now, please make sure that, this is what you're doing and you're taking care of yourself. So, it doesn't get worse or you don't give it to someone else.
Yeah, most definitely. Because like you said, that was almost 20 days, from the time that you called until you got an actual appointment. So just thinking, I mean, what all can we do in 20 days? So let's just up and think what we can do in 20 days. How many partners could we technically have in 20 days? And just thinking that, you got those 20 days from the time that you called to get an appointment. And then even when you get the appointment, you also have to wait an additional, couple of weeks in order for you to get your test results. So,
your private could be falling off and it's just gonna be hanging. Gotta
yeah,
go to the emergency room, get it sewn up or something. I don't know.
right.
You gotta figure something out.
Right. Yeah. So I would say that was one of the things that surprised me. Was just a time frame, from the time that you called and for the first available appointment.
And like I said, I called multiple health departments, so it wasn't just one. I called like Jacksonville, Southwest, North Little Rock. In January, the 28th was literally the earliest I can get, and I think the latest I had was April 10th of some facility.
So 3 months to get an STI test. My goodness. All right, Maya. So what would you tell someone who's scared to get tested? What would be some of the things that you would say to them, especially as an ambassador, doing this work in which you're working with your peers? What would you tell somebody that's scared to go in and get tested, based on what you went through in your experience?
Don't be scared. It's gonna be okay. And if you're looking for, young people, to talk about it with, come check out Village Public Health. You know what I mean? We're for the youth, we're for the people. If you need some comforting, come vibe with us. You know what I mean? But yeah, don't be scared. Like your health comes first, you come first. You gotta put yourself first. You know what I mean? It all matters, and you don't want to wait till it's too late before you do something, because the longer you wait, the worse it gets.
Oh yeah, most definitely. And then also, we have ambassadors that would love to go to the health department with you, so if you need somebody, and we're going to put a plug out here for Village Public Health and our wonderful ambassadors, if you would like someone to talk to about going to get tested, or I mean, if we have time, because we know we're all busy around here, if you need someone to go to an appointment with you to make you feel better, because like Maya said, we're just, concerned about your health. If that's what it's going to take to get you tested, we will definitely go and support you with going with you to get tested as well. So, all right. So, why do you think?
Oh, one
Why do
more
you?
thing real
Oh,
quick.
go ahead.
My bad.
Go ahead.
As well as I would say find friends or people around you, who care about themselves as well. If everybody around you gonna crack a joke because you care about, putting your health first, then you need to let them go. You don't want to be around people that don't care about you or themselves.
Okay. Yeah, most definitely. Most definitely. Definitely having that support, with individuals who don't judge you. One of the important things that you pointed out was about the stigma and all of that, because at the end of the day, you have to take care of yourself. You got to take care of your health. And today is National Testing Day. So we're all about, encouraging individuals to go get tested, because as we talked about before, and several of our other vibe checks, about you have STIs that are asymptomatic. So you could be walking around here with STIs and won't know you even have anything until you go get tested. So definitely we want to encourage all young folks because as we seen today, Maya was able to get that appointment, even though it took 3 weeks. She still was able to get up in there and get her appointment at one of our local health departments here in Arkansas. All right, Maya. So what's one key takeaway from your experience that you want people to remember? So what is one thing, if they did not learn anything else today, that you would want them to take away from your experience with going to get tested?
I guess just go get tested. It's nothing to worry about, nothing to be scared. If you can go to Jimmy John's house, or go to the hood, you can go to the clinic. You know what I mean? You up in them sheets, go to them streets and to the clinic.
Loving you up there in them sheets. Go to the love it, love it, love it. So, so there you have it. So we have our ambassador who actually went and got tested, y'all. So we're not sitting on here just talking about things that we're not going to do ourselves. We actually had an ambassador who talked about her experience from going to the health department, actually setting the appointment, was able to get in and out. And one of the things that she noticed, she didn't even have to pay anything. So don't even let cost be a barrier to you actually going to get tested, because as she said, and she mentioned, that there is no cost for you to get testing and get screened at the local health department. So yeah. All right. So do we want to turn it back over to Dr. Q?
And ladies, that was amazing. Thank you guys for number one, Maya, thank you for being vulnerable and being willing to, number one, rise to the challenge of helping us navigate what this looks like for a young person, but then also just, being bold enough to want to talk about it. Our goal is to destigmatize these conversations. Going and getting tested if you are sexually active should be the same as when you go to the doctor, you know that they're going to weigh you. You know for a fact they're going to take your blood pressure, and you know that they are going to take your temperature. It's just normal. Getting a test should be normal. Why does it matter? As we reflect on today being National Black HIV Testing and Awareness Day, we need to normalize these conversations. There are things that we could have going on in our body that we don't know about because we're not having symptoms. We're asymptomatic. We could indeed have an STI, but not be one of the lucky people that don't have symptoms. In that case, we're putting ourselves at risk and we're putting our partners at risk, not intentionally. So it is important that we get tested and that we debunk the myth that everyone that has an STI is going to have symptoms, because that simply is not the case. We also want to raise awareness around being asymptomatic, because you could be walking around here mad at somebody thinking that they intentionally gave you something. And the fact of the matter is they were just unaware. So like Maya said, that if you are out here sliding in those sheets, be brave enough to go, take that journey over to your local health clinic. However, it is important to note that there may be a delay. There may be a delay in getting tested. And please note that if you are symptomatic, the emergency room, yes, they're going to treat you at the emergency room, but that should not be your first line of defense. There are other avenues that you can take. We have a lot of partners that offer testing that have at-home kits that you can pick up and do the testing at home and submit it to the lab, or even give it back to one of our community partners, and they'll be able to get that submitted to the state lab. So there's more than one way to skin a cat, like the wise people like to say. If you are uncertain about how to get tested or how to get an at-home kit, give us a call, 501-229-9220. Shoot us an email, check out our website, villagepublichealth.org, tap that contact us or need more information link, and it'll come directly to Maya or I, and we'll get back with you to make sure that you get connected to the resources that you need. And then last, but certainly not least, if you need condoms, we got plenty. By all means, please reach out to us. Don't be out here in these streets without no condoms, without no protection. We have those. We have them plenty, and we're happy to give them to you. As we continue to navigate through the month of February, we are elevating the importance of knowing your condom size. Not only do we have condoms, but we also have Measure Your Penis kits. It is important to know that one size does not fit all, and not everybody needs a Magnum, and that's okay. Know your size, know your fit, so that you can protect yourself safely and effectively, and that you can also show love to your partner by taking care of yourself. On that note, guys, we're out. Have a great day.